All right, let's talk a little bit about the covenant not to compete. So there's a little bit of misinformation out there about the covenant not to compete. So when people think about the covenant not to compete, they're thinking about two different times that it comes into play. The first is in employment agreement, and then the second is when you are buying or selling a practice. So in most situations, a covenant not to compete with regard to an employment agreement in most states, not all, is illegal. And so you have to be careful about putting that in your employment agreements. States like California are absolutely illegal, and then some other states like Georgia are better about it. And then there's a lot of states in between that allow some fashion of a non-compete, but not, not sort of a super strong one. But the one that I want to really talk about is the covenant not to compete with regard to a practice purchase or sale. Here, in every state, it is allowed where the buyer can prevent the seller from competing against him or her after the sale has happened. And this is very important because obviously we wouldn't want sellers to sell you a practice and then walk down the street and open up a competing office. If they did that, then all those patients would just walk on over to the other office and would be in trouble. So you want to make sure the covenant not to compete is well defined and that the mileage is set in stone. Depending on the area, we always recommend at least 15 to 25 miles. You don't want to go more than 25 and not really less than 15. But in some situations, it could be a little bit less, but those are really, really rare. So if you have any questions about any of this, make sure you give us a call. Thanks.